Hi, my name's Logan. I'm in a group with Jennifer and Courtney, and we were assigned the Certified Nurse Midwife for our advanced practice provider. A little bit of introduction. So certified nurse midwife. The model was initially brought to the U.S. by Mary Breckinridge in the year 1925. She kind of pioneered the way for nurse midwifery and also developed some ways for how modern nursing can work in different rural communities. Um, certified nurse midwife is legally licensed and competent in their practices. They have led the way for all other advanced practice registered nurses. They follow holistic patient-centered care for women. They have 6 different competency guidelines that they incorporate into their practice. The future shows an increase in a demand for certified nurse midwives to meet the growing need for this profession. A little background. CNMs have specific training for pregnancy, childbirth, and postpartum, usually about 6 weeks. And then they will care for the babies themselves up until about 28 days, and then the pediatrician will take over after that. Specific education makes them pretty much experts in these areas. Requirements to be a nurse midwife. It's a graduate level education, just like a nurse practitioner. They get their education from an accredited certified nurse midwife program. They can either do a master's or a doctorate degree, and then they have to pass the national certification exam at the end of their program to get their license from the American Midwifery Certification Board. What other areas do the APNs typically work in? So they work in hospitals mainly. Otherwise, there's private practice clinics. They can work in patient homes, birthing centers, public health sectors, community health centers, and they can also work solo by having their own personal practice, or they work in group settings in hospitals and throughout other cities, small towns, and rural areas. So yeah, the function is independent primary health care providers for adolescents through the lifespan. Specialize in pregnancy, childbirth, and postpartum periods. Like I said before, they care for newborns up to about 28 days old before the primary pediatrician takes over. If needed, they can treat male partners for sexually transmitted infections if their patients that are pregnant are infected as well. They can also assess, interpret findings, diagnose, and treat their patients. They can prescribe medications, controlled substances, and contraceptions. They can admit, plan the care, and discharge patients from the hospital, order labs, diagnostic tests, make referrals to other specialties, and they just overall promote positive health behaviors through coaching and counseling. So according to the American College of Nurse Midwives Leadership Competency and Skills, there are 6 different guidelines for CNMs to follow to show great leadership and stewardship. This is a list of those 6 guidelines and competencies, and I will go into those within the next few slides here. These competencies aren't set in stone, but they should be used as a guideline for continuing education, advancing skills, practice methods, and just the overall basic midwife core competencies and ACNM code of ethics. So the first competency is contextual understanding. To better understand this, the CNM needs to have knowledge of past, present, and future midwifery in the United States. Ways to do these would just be to be aware of the internal and external environments affecting midwifery. They can look at history of midwives in the U.S. and how the influence of current workforce and care models along with the current healthcare system. Know the role of the midwife and the scope of practice within the United States. I think their scope is pretty much different in majority of the states, so depending on what state they work in, they need to know the scope of their practice pretty well. Learn about sexual and reproductive health and understand how it is going to be different in every community and population that they work in. And they have to understand the correlation between political, educational, and clinical areas of midwifery. Political, especially with the recent change in the Roe v. Wade decision to now where the abortion decisions is pretty much different in all different types of states throughout the country. So knowing those laws and how they affect your practice is very important. Second competency is just professional expertise. They have a specific professional role and can use these skills as part of a leadership role. So they need to continue to look at existing research, policies, and other key documents that can affect their healthcare process and outcomes. They need to continue practicing skills such as benchmarking, quality assurance, risk management, advocacy, and health policy to help demonstrate a specific leadership role. Project management skills are important, such as planning, executing, overseeing projects, constantly looking for continuous learning and educational opportunities as well. The next competency is self-awareness and self-development. You could really just think of this as continuing education and furthering your own education of your practice. So the core skills could be identifying your self-strengths and areas that you need for improvement, being vulnerable and practice self-reflection and resiliency, being open to feedback and being able to provide positive feedback, being aware of burnout and recognize when that occurs and how to manage it, and then being able to identify a problem and coming up with a solution and acting upon it. Next, we have communication as a change agent. So CNMs interact with a range of other healthcare providers, whether it be nurses, aides, physicians, pharmacists, kind of all down the line. So communication is a great key to help convey the meaning that they are trying to get across and build a shared understanding, just to move their agenda forward altogether. So being able to communicate both written and spoken with all the contributors of the healthcare program, being able to use formal and informal networks to keep relationships strong, evaluate evidence-based practice and research, provide positive and constructive feedback to all the members of the healthcare system, and being able to identify all cultural perceptions of midwifery across the healthcare system. Next, we have the operationalization and execution. So the CNM adds operational and executional skills to the team, meaning that they are able to strategically plan a vision and practice, applying policies and ideas into their practice, research evidence that was evaluated by other multidisciplinary teams, being able to execute professional boundaries and shield professional autonomy, being equal to all race and genders during practice, and then build teams toward a shared vision and goal. So the last competency here is transforming the future of midwifery. The CNM represent expert levels in showing change in processes, generating new knowledge, and supporting the development of new midwifery leaders. Some of these skills include transforming patient outcomes by generating knowledge on the effectiveness and role of midwifery, being able to adapt to new and existing solutions, supervising, mentoring, coaching future midwifery leaders and other team members, and then being open to diversity in leadership and encouraging such an environment. So some challenges that the nurse midwife role has in their everyday practice. There's a small number of practicing nurse midwives. According to the ACNM, there's only 46 accredited programs in the US right now. There's a lack of funding federally that can kind of lead to the decreased amount of programs. But just for like some context, nurse practitioner programs, there's about 500 different accredited programs in the US, so it's quite a difference in how many programs there are available. Low third-party reimbursement that has to do with insurance. So there's an inequality between the physicians and the CNP's reimbursement rates. These vary state to state, obviously, but only 2/3 of the U.S. states make private insurance reimbursement to midwives, and that's only to some extent. When it comes to Medicare and other government insurances, it doesn't seem to be too much of a problem for them. There's an expensive professional liability insurance that goes along with the nurse midwife. So the maternal care statistically just has a higher litigious rate. It just means that if issues arise and things go wrong, they're at a higher risk for having legal involvement and possibly being sued. The high cost of malpractice insurance kind of limits access for nurse midwives in private practices. A lot of these patients want to do home births, and there's obviously risks that come along with that. And unfortunately, nurse midwives could be held liable if things do not go according to plan. So the future of the role, according to the Nurse Journal and the U.S. Bureau of Labor and Statistics, predicts that the nurse midwife role between 2020 and 2030 the demand of it will increase by about 45%. There's a high demand in individuals that want to consider seeking higher education, whether it's a DNP versus MSN program. Other potential changes come into this role. Progress and continued work toward full practice authority in all states. So like I said before, not all states have the same laws when it comes to the nurse midwife. So trying to get just like it is with nursing, but trying to get a blanket scope of practice throughout the whole country could help kind of further this role and decrease the amount of challenges that they face. Increase accessibility to nurse midwife services to all women in all care settings. Improve collaboration between nurse midwives and OBGYNs. Enhancing racial diversity within the profession. And then closing the gap between patient demand and the use of a midwife. It's usually a personal choice whether a patient wants to go with an obstetrician or a nurse midwife. With the increase in nurse midwives, they kind of take the load off some of the obstetricians that have so many different patients. So sometimes it's a better choice for a patient to choose a midwife versus an OB. Just overall summary of the certified nurse midwife. Their model kind of highlights person-centered care. They focus on pregnancy, childbirth, newborns up to 28 days, and then the six-week postpartum maternal care. CNM can work in various different settings, whether it's a solo in their own private practice or with other providers. The outcomes for the mothers and infants are improved when a CNM is usually involved in their care, whether they are the lead provider or if they're working alongside an OB. The scope of practice includes prescribing, diagnosing, and managing the care of their patients. Some of the challenges, like I mentioned before, are just the minimal accredited programs that are out there, the low reimbursement rates for insurance, and then the expensive liability insurance that they have to pay for. Future midwife demands is projected to increase by about 45% into the year 2030, and then position could progress to full autonomy across the country with continued healthcare reform. Some goals to integrate more midwives into the practice to help close these gaps to provide in provider shortages and maternal health disparities. These are our citations that we use throughout the presentation, and thank you for listening.